Hello everyone, and welcome back to my show. I'm Dr. Lot from Acupuncture is My Life. For those of you who are familiar with my show, you know I plan to discuss a topic from one of my more popular recent chat discussions, which over the past 2 days focused on diabetes and the common cold. Now, for those of you who do not have the Acupuncture is My Life app, simply go to the Google Play Store and download it to access private chat sessions with Acupuncture is My Life, as well as learn more about acupuncture, Chinese herbs, Eastern nutrition, and also gain free access to telehealth. Now, with the onset of cold and flu season while dealing with this crazy pandemic, some of you guys may not want to come into my office for an in-person visit. But guess what? We can enjoy a session via telehealth totally free if you simply download the app. Now back to diabetes and the common cold. I've been bombarded with questions over the past 2 days as to if a person's blood sugar can go up if they get sick, or how often should an individual check their blood sugar if they were to come down with a cold, to even what should one eat or drink if they were to catch a cold. The answer to what you should eat or drink, you'll have to watch an Eastern nutrition episode on this channel to find out the answer to that. You see, the common cold is one of the most frequent causes of acute illness in the United States, along with many other countries. Now, when it comes to diabetes and the common cold, your basic symptoms, which are considered symptoms of wind cold or sometimes wind heat, in Chinese medicine can come with a risk, because when you're sick, especially with the common cold, there's a very high likelihood that your blood sugar will rise. So the answer to the question of blood sugar going up is when you come down with a cold, your body emits hormones to fight off the infection, whereas the fallout from that is this further compromises your body to effectively utilize insulin properly. Let's take, for instance, type 1 diabetes. If your blood sugar levels become too hard to manage based on the severity of your cold infection, it can lead to ketoacidosis, which is potentially life-threatening. Whereas with type 2 diabetes, especially if you're older, high blood sugar as a result of being infected with a bad cold can possibly lead to diabetic coma. My recommendation, although I'm not a medical doctor, but as a state licensed, board certified doctor of acupuncture, I would recommend you check your blood sugar at least, or I would say every 2 to 4 hours if you're sick with the common cold, as well as stay in close contact with your primary care physician. Now, as I've stated in previous episodes on diabetes, from a traditional Chinese medicine perspective, it's primarily seen as a yin deficiency disorder, which presents with a pattern of heat dryness. The main organs that tend to be involved from a Chinese medicine perspective are the lung, stomach, and the kidney. For example, when the lung is involved, which represents the upper source of body fluids, lung yin deficiency with heat dryness usually impedes the lung's ability to disseminate body fluids, which therefore leads to the stomach, which is in the middle jiao, and the kidneys, which is in the lower jiao, to suffer from secondary yin deficiency. Now, remember from my earlier episode on the basic function of the kidney in Chinese medicine, where I stated kidney yin being the foundation that supplies fluids to the entire body? Well, whenever kidney yin is deficient, lung and stomach yin will eventually become deficient as well. Once this disorder becomes chronic, yin can no longer support yang, and as a result, yang becomes deficient, and with both yin and yang being deficient, complications of multiple organ systems can present. So if you haven't seen the episodes on the basic functions of the stomach and kidneys in Chinese medicine, please take a moment to view them so that you can have a better understanding of what I'm talking about regarding those organs from a Chinese medicine perspective. Now, a good example is a previous case in which I had during the past cold and flu season, where the patient had presented with lung heat that injured the body fluids, accompanied with a mild case of wind heat attacking the lung, in which this patient had presented with an acute cough, a mild sore throat. I think he had some irritability, frequent drinking with, let's say, a dry mouth and tongue, and polyuria. The edge of the tongue was red with a thin yellow coating, and he had a rapid pulse. In this case, I knew I had to release the exterior and expel wind heat, as well as moisten the lung and clear heat from the stomach to generate fluids and to alleviate thirst. So I needle points on the heart and the lung channels to release the exterior and treat the heat and urination issues, which in this case was polyuria, and to nourish and regulate the lung to promote the function of diffusion, as well as nourish the heart. Now, I also needle points on the bladder channel and conception vessel to regulate lung and heart chi and clear heat and regulate blood, as well as address the thirst and dry mouth. The patient fared pretty well after just 2 sessions, and he comes periodically for wellness care, which works out well for him. Now, if you're ever again interested in holding private chat sessions with Acupuncture is My Life regarding any ailments you or a loved one may have, and if acupuncture can be of benefit to you, simply go to the Google Play Store and download the Acupuncture is My Life app to do so. And don't forget to subscribe to this channel to learn more about acupuncture, Eastern nutrition, plant enzymes, Chinese herbs. Now, until next time, acupuncture is my life. What's yours?